Hello, everybody, and welcome to this episode of Grand Rounds where we're going to dive into acne cases. This is going to be fantastic. I'm Lisa Swanson. I'm a dermatologist and pediatric dermatologist in Boise, Idaho, and I'm joined today by Kristin Rygg. Go ahead and introduce yourself, Kristin.
Hi, everyone. Thanks for being here. I'm Kristin Rygg. I'm a derm PA in Denver, Colorado.
So excited that you guys are tuning in to us. We're going to talk about one of my cases today, and I think you all will be able to resonate with some of the details of this case. This is a 16-year-old guy, 16-year-old male with moderate to severe acne, came in with his mom, and he said that he's had acne for 2 years. He's a very active teenager playing basketball and running track. And in the past, he was prescribed tretinoin by his primary care provider, but he didn't really use it. He admits that his acne previously didn't bother him very much, and so he found it hard to be consistent with any sort of routine because he just wasn't really thinking about it. But now things have changed, and he's ready to take command of the situation and do something about it. His mom has purchased a variety of over-the-counter acne remedies, face washes, back washes, etc., but he has been poorly consistent with those as well. And Kristin, I don't know about you, but when I see a teenage boy, I used to start by asking them what they use to wash their face. And now I start with, do you wash your face? That's my first question.
Exactly.
Do you ever wash your face? And then once they answer that, I say, okay, how frequently and what do you use? And more often than not, they don't even know what they're using. They look to their mom. They're like, whatever she buys me, it's in the shower and I use it. Has that been your experience as well, Kristin?
Oh, absolutely. I also think we have to ask them how often they're showering
Right?
and are they using their body wash on their face?
So now his acne is to a point where he is bothered by it and he wants to do something about it. So we took a look at his skin and he has numerous comedones and inflammatory papules on his face, maybe 1 to 2 early scars. And he has several small inflammatory papules on the chest and the back. And these are representative photos, not of my patient, but of a similar patient. My patient's back acne was probably just not quite as significant as this, but he had this distribution of kind of face and back. And Kristin, I don't know about you, but I find it difficult to control truncal acne with only topicals. Do you experience that as well?
Oh, absolutely. And so many people, even if you show them how to put on their back topicals or their truncal topicals using the back of their hand, many of them still can't put it on or don't want to put it on. So I often look to a different alternative for that.
Yes, and a lot of times we're recommending benzoyl peroxide washes, which bleach things, and hopefully it just bleaches their towel. But I always fear that when we're using it on chest and back, that it'll bleach their clothes. And so that leaves things that are kind of less than desirable about that treatment aspect. So we talked about our options. I always talk about everything. So for boys, I talk about topicals, oral antibiotics, and isotretinoin. I've also recently started to talk about oral probiotics. I also encouraged good, simple skincare and the importance of washing his face and showering after basketball and track. And we ended up going with topicals and an oral antibiotic. So we started with Cabtrio for the face, benzoyl peroxide wash for the chest and back, and then doxycycline, 100 milligrams daily with food. And I feel like there are so many dosing regimens for doxycycline out there. Some people do 50 milligrams a day. Some people do 50 milligrams twice a day. Sometimes it's 100 milligrams a day. Sometimes it's 100 milligrams twice a day. What is your regimen of choice if you're prescribing doxycycline, Kristin?
Yes, well, that's a great question. I work very closely with my collaborating physician, and she really likes to use doxycycline 100 milligrams twice a day with food, with a full glass of water, at least an hour before bed. So many rules. And the challenge is you can't get people to take it as often as we'd like. And then we have to worry about resistance and all of the things. So, but that's our current routine.
And I think that's probably why over the years I started out as a doxy twice a day person and I ended up becoming once a day just because with the water and the food and all that kind of stuff, I just felt like twice a day was so hard for folks. And so I think as a result of that, I tailored my regimen to just one pill a day. So we see him back 2 months later. I always do my follow-ups at 2 months. Are you the same as well?
I usually do 6 to 8 weeks because a lot of kids need a little prodding about, maybe how they're using their skincare routine or if they're pleased with their skincare routine. So just about the same timeline.
Yes. And frequently I'll first ask, like, did you get both of the medicines? Because sometimes with prior auths and insurance shenanigans, sometimes there's been a delay. So I would say, did you get all your medicines? Yes, I did. And then are you using them? And especially with the topicals, especially with the boys, I frequently will say,
Right.
out of 7 nights in a week, how many nights are you typically applying this? And I feel like usually they give me an honest answer when I phrase it that way.
And
Um,
we're absolutely excited about 4 days or more, right?
exactly, exactly. And I make it kind of like okay that they're not being super, super consistent.
Hmm.
So we follow up at 2 months, and I find out that they actually had to discontinue the doxycycline due to the gastrointestinal upset. And I see this happen quite a bit. And actually, back when I practiced in Colorado, I also saw so much of the sun sensitivity from it because the altitude and the intensity of the sun. But I feel like I tell all the patients, like, take it with food in your belly, a full glass of water. Don't lie down for an hour after taking it. And even still, some of them get upset tummy or they feel that like esophageal discomfort. And so that's just one of the downsides to doxycycline. Do you have any tips as to how you tell your patients to use it?
Well, before I practiced in dermatology, I actually practiced in gastroenterology for a
Oh, there
couple
you
of
go.
years. So I saw a lot of pill-induced esophagitis. So every patient has to have it with food, a full glass of water, and then we try to avoid laying down for at least an hour. And then we often will try and tell patients not to take it with a full calcium meal, just so it doesn't chelate and cause other problems there. But that's tough. If you've been on it, it's hard to do.
He says that he is using the topical triple combination gel, the Captrio. It's been somewhat helpful, but not quite enough. We rediscussed all the options, including the different topicals, different oral antibiotics, oral probiotics, and isotretinoin. Mom had a lot of concerns about gut flora and just the effect of oral antibiotics on the gut. And so she was also worried, as so many of our patients are, about potential side effects and risks of isotretinoin. I feel like I spend so much of my day kind of talking people down from some things that they've read on the internet about isotretinoin. And as somebody who used to practice in Colorado, I know those fears are there in the Mile High City as well.
Every day we come across that question.
Well, and I feel like so much so that I mention Accutane and the parents are like, oh no, we're not doing that. And I'm like, oh,
Hmm.
really? Like, what have you heard? And sometimes they don't even really know why they're afraid of it. Sometimes they're like, we just heard it was bad.
Hmm. And we also live in a desert here in Colorado, and so many people do. So you're multiplying dryness upon dryness.
Yes, yes. And so I always tell people, not that Accutane is right for everyone, but I would hate for somebody to be avoiding it for the wrong reasons. So please talk to me about what you've heard and what you're concerned about so that I can help alleviate or confirm some of the things that you had heard before. But we talked over all these options and we opted to continue the Cab Trio and the benzoyl peroxide wash and add in Seysara. And Seysara was particularly appealing to this patient and his mom because we know that oral antibiotics offer really rapid efficacy. And we know that Seysara does not cause the GI upset or the photosensitivity that is so commonly associated with doxy. And we have data from our gastroenterology colleagues saying that Seysara has minimal impact on gut flora, which I think is just a huge differentiator. And given your experience in GI, Kristin, what are your thoughts on that?
Oh, I think we're just at the tip of the iceberg learning about the microbiome. And I think that it's a question that we really, if we're not asking ourselves, should we be giving this patient an oral antibiotic such as doxycycline or minocycline, or can we do something that has been proven not to affect the gut flora? I think we have to make that decision wisely.
Totally, totally. I think we're learning more and more that gut flora is everything for our general health, even for like depression and things like that. Those serotonin, is it serotonin receptors that are in the gut? Is that right?
I believe so, but don't quote me.
Yeah, yeah, yeah. And so we know that the gut matters. And so Seysara is so appealing because of its minimal impact in the gut. So we decided to go ahead with that. And we followed up 2 months later, and everything was going really great. He was able to tolerate the Seysara, so he was still taking it and having no side effects or issues, marked improvement in the acne on the face and torso. And mom was happy to have avoided isotretinoin. The other thing that's kind of special about Seysara, most of the time, pretty much all of the time, when I prescribe doxycycline or minocycline, I'm telling people we're only doing this for 2 months. 3 months tops, antibiotic stewardship. We're not going to overprescribe these antibiotics. It's just to give you a head start while we hope and wait for the topicals to kick in. But with Seysara, we don't necessarily have that pressure to get off of it as soon as possible, which is nice.
Yes. No, they have safety and efficacy data, safety and tolerability data out to 1 year. So it makes me feel very comfortable if patient does want to go on isotretinoin, but they're trying to postpone that or do some of their other activities or get through their finals, something before they go off to school.
So this patient was able to continue the Seysara along with his topicals and continue to thrive and do really, really well. So a happy ending to this story.
I love it.
Any other thoughts, Kristin, about this patient's journey?
No, I would love to see some after photos of your patients because it sounds like you have them on a great routine.
I know it's so hard. I take pictures of so many things in clinic, but for some reason, acne, I'm really bad at remembering to take before and after pictures. I try to do it, but I don't succeed a lot of the time.
I think we have a lot of things to focus on, so we'll give you a pass.
Yes, yes. But trust me, he looks great. He's doing great.
Very good.
Well, thank you guys so much for tuning in. Thank you, Kristin, for being my partner in crime. And we hope you guys enjoyed this acne grand rounds. Please tune in to some of our other episodes.